Hey there. Time for a quick update on my hip replacement surgery. Before I go on, just wanted to make sure that everyone knows that this is not medical advice. I am not a doctor. This is no way intended to replace information that you get from your doctor. I am simply sharing my experience with my surgery. So take it for what it is. So I just had my consultation with my surgeon prior to my surgery. My surgery is in about 10 days or so. And I went in there with all my questions that I came up with. And I started asking him questions, and I wanted to go over some of those answers for you. First one was, what surgical approach is going to be used? It's going to be the posterior approach. And I asked plus or minus, and he goes, I only do posterior approaches. It's easier to do, less complications, and so forth. So much for that. What's the anesthesia approach? That was an interesting answer I got. And it turned out that he doesn't determine the anesthesia approach. It's either going to be a full general anesthesia or the spinal block type anesthesia. And he goes, that's between me and the anesthesiologist. So basically, the anesthesiologist hands me over to the surgeon when I'm all knocked out and so forth. So that's a decision for the anesthesiologist and me to come through. How long will the surgery last? He said maybe an hour, hour and a half, 2 hours at the most. So not too long, but long enough. Lots of risk. I mean, every surgery has a risk. And he told me that the biggest risk was risk of infection, which they try to treat post-surgery with antibiotics and good hygiene practices and all of that kind of stuff. So that was the biggest risk of the surgery. And then I asked him, I said, well, I'm not the lightest, smallest guy in the world. I'm kind of a big guy. Does my weight and age, I'm almost 70 years old, does my weight and age have a factor on this? And he goes, well, of course, the older you get and so forth, but he's assured me that my weight and my age will not interfere with what he needs to do. And he's operated it on much older people and much heavier people than me. And he says with really good outcomes. So I'm very confident that that's not going to be a factor for me. Let's see, what kind of complication rates do you have with these types of surgery? He goes, very few. I think he said he only had one person get a post-operative infection that they dealt with very quickly, but he's done hundreds of these operations, so he's very experienced. And I have lots of confidence in his ability to get things done here. What should I bring to the hospital on the day of the surgery? He says, besides yourself, just make sure, make sure that you're wearing loose-fitting clothes, make sure that you are wearing closed-toed shoes, and that you have somebody to drive you home after the surgery, because they will be sending me home more than likely after the same day after the surgery if I pass the tests, the post-op tests and physical therapy tests at the end of the day. How much pain should I expect? And he goes, well, the good news is your hip pain will be gone. The pain that you're going through right now with your inability to walk and bend over to tie your shoes and put on your socks, all that stuff, that's going to go away. There's going to be obvious post-operative pain because they are operating on you, right? So he goes, but we have the pain management narcotics for that, and hopefully you won't need too many of those, and just Tylenol will be able to be able to manage that pain. But yeah, the pain is expected, and I'm not unaccustomed to that kind of thing, but it's good to know what you're kind of getting into. But he goes, as you progress, the surgical pain will get less. And just kind of monitor yourself as you go through. We had a good discussion about what I call good pain and bad pain, right? I played a lot of sports. I played a lot of baseball. And as an ex-athlete, you kind of know when your body is telling you, you're having pain, but is it a good pain or a bad pain? Good pain is muscle soreness that you've exercised and all of that. Bad pain is something, sharp, intense, not expected, that kind of thing. And he let me know that you know your body the best, so you know the difference between good pain and bad pain. So good pain is all right and will be expected. Bad pain, if you have bad pain, come and see me. And we talked about the signs of infections and things like that. So I'm pretty well primed for that kind of activity. Let's see. How does physical therapy work after surgery? Is that something that I set up or you set up, or what? Do they come to my house? Whatever it goes. The best physical therapy, and this is again my doctor talking to me, right? The best physical therapy is the outpatient physical therapy where you go to them because they have all the weights, they have all the machines, they have all the people there. They won't bring all that stuff to your house if you want them to come to your house. So go to them if you can, and more than likely you will go to them. So he wrote me an order to set up physical therapy, and I now have 6 weeks of physical therapy on the books scheduled out with a company here locally, and it starts 6 days after my surgery. So basically, little less than 1 week after surgery, I'll start physical therapy with the professionals there. I asked him about what movements and what activities after surgery should I avoid, and it's kind of all the standard answers. Don't bend your waist more than 90% after surgery. Avoid turning your feet outwards after surgery for the first week or so, which again precludes me from driving because I'm having my right hip replaced. So that's my right foot is my driving foot, which needs to do this kind of motion. And he goes, yeah, that's not good. But pretty much you're good to go. There's not too many restricted motions from the surgery. I asked him what kind of the general timeline for recovery is, and he tells me that everybody's different, and obviously I know that everybody's different, and the generally 1 to 2 weeks should be, with the first couple weeks I'll be using a walker, but after 2 weeks you should be able to graduate to a cane. And then after about another 3 to 4 weeks, so at around the 6-week period, I should be able to move pretty freely without the walker. And that includes walking through the house, doing short walks in the neighborhood, which I'm looking forward to getting back to, and so forth. So that's kind of the general timeline. I specifically talked about golf, though. And when can I start playing golf again? And he goes, probably in and around the 4 to 6 weeks when you feel good. You can go to the putting green and the chipping green and start working on your game and sharpening your game on pitching and putting and so forth. And he goes, probably in about 2 to 3 months, somewhere in there, should be able to do like 9 holes with a golf cart, which I was kind of surprised at. I'm looking forward to that. So kind of general timeline, but again, everybody's different. We don't know how things are going to work out, but if I stick to the plan and stick to the physical therapy and all of that, things should be pretty good, I'm hoping. A big one for me, I have a swimming pool in my backyard, and I like to exercise using the swimming pool. And I asked him, when can I use my swimming pool again? He goes, yeah, that's going to be an issue, probably 5 to 6 weeks at least. The key issue is keeping the incision dry so it can heal and close up and heal correctly. Getting it wet is a big no-no. And then plus with all the chemicals in the pool and stuff, he said, no, 5 to 6 weeks and let me give you permission before you go and do that. So we'll have to see how the pool activity returns. Can I use a recliner to sleep at night because I'm a side sleeper? And is that going to be an issue? And he's going, well, if you sleep on your side that you're operated on, then you'll have incision pain and things like that. But it's kind of better to sleep on that side, the side that you had your surgery on. So that would be my right side, because when you sleep on your opposite side, your operated leg tends to cross over there, and you don't want to cross your leg over and stretch that hip joint out too much at the beginning. So I asked him, can I sleep in a recliner that keeps me on my back? He goes, absolutely. That's a good place to be. I've heard both, kind of doing my research, and my doctor reinforced the fact that yes, I can use a recliner to sleep if I need to. How much walking should I do during recovery? And he goes, well, you should be walking every day. And then at home, once you get home, probably in the first couple of weeks, at least once an hour, while you're awake, to be able to get up and move. The key thing is to keep moving and keep that new hip joint moving and it kind of expanding the range of motion. So he said about once every hour, get up and walk the house, take a short little walk outside, kind of thing. That seems to be pretty good. And I'm sure my wife will be, the love of my life will nag me to death to get me up and going again and get me walking. So I'm kind of depending on that as well. As long as, the big caveat was in the first week or so, using the pain medications and being very careful, because the real critical thing that he emphasized was do not fall. Do not fall at all. Avoid it at all costs. So, be steady on your feet, use your walker, use your cane, be careful when you walk, that kind of thing, but get up and walk and move. That was the real critical thing. How long before I take a shower again? He goes, well, probably, in about a week. You can sponge bath, in the first week. When you take a shower, make sure you have like a shower wand that kind of concentrates the water. The key thing is keeping that incision dry. And they will, they'll send me home with a waterproof bandage over it. And then I go in for my first post-op visit about a week after, which he takes the bandage off and looks at it and checks the incision, make sure everything's going okay. There's no infections going and so forth. And then he'll put another Band-Aid on there. And then in another couple of weeks, I'll go back in to have the staples removed and again re-inspected. He goes, during this time, just keep the incision dry. You can take a shower, but keep that incision dry. So whatever I need to do to be able to do that, that's the key thing. Let's see what else. And again, the rest of my questions were about golf and returning to golf. And he goes, there's no reason why you can't return to golf. Do your exercises, do the PT. And this is what I've heard from everybody. Make sure you do the PT after your surgery, through your recovery. The more exercise you can get, the stronger you can get, the more motion you can get, the quicker and better you can return to the things that you really like to do. And one of the things I really like to do is play golf. So I'm hoping, back to what I said before, probably about week 6 or so, forth, when I feel pretty steady on my feet without a walker and minimum use of a cane, I can go out to the putting green and putt and do some chipping drills and so forth. And then probably by 2 to 3 months, do some light swinging on the driving range, and eventually get to the point where I can play 9 holes on a golf cart. Again, my ultimate goal for this recovery is to play and walk a full 18. So I have that out there to to try to achieve, and damn it, I'm going to achieve it. I'm sure I will. So all I have to do is stick with it. So with that, those were my questions. He did hand me a nice packet about total hip replacement and go through all the details. It details what drugs he's going to be giving me, what kind of equipment I need, how to prep for the surgery, how to manage my existing medications, all that stuff. Some basic exercises to do at home after the surgery. So this has been a very good little packet to have, and I've read it over twice at least, and I'm going to be reading it over a couple more times, I'm sure. So again, my surgery is in about 10 days. I'm very much looking forward to it. I would say I'm anxiously looking forward to it. I'm very anxious about the major surgery that's coming up, as well as anyone should be. But after meeting with the doctor and going through the details of all the questions and answers, I feel confident. I feel like it can't happen soon enough, because the sooner I get the surgery done, the sooner I can start recovery. So I'm hoping that works out. So I'll post another video after my surgery to let you know how things are going, and then give you some post-surgical updates as we go through. But until then, wish me luck, and we will talk to you soon.